So, it's a saga today going on today. Right. I have found out by this UK One's Area Medical Practice employee, because I updated about what's happening and being extremely, again, disadvantaged and right. And I found this out. So, yet again, the saga keeps going on. Social Security Statutory Law Regulations 2013 reference personal independence. Extremely disadvantaged, and here we go. Finally find out that there was deliberate attempt to put down this failure to attend. The failure to attend team is based at Department of Works and Pensions, your area, whoever you deal with, and it's up to the individual to prove why you failed to attend. Excuse me, this is a home visit at 9:15 a.m. when I can't bloody walk. A good cause, ground, this is a factual good cause, reason behind this. The nature of one's disabilities, and they have to go on the full picture. I've actually got an email for the complaint to my area office. And so basically, with due respect to the extreme efforts today, appreciate it, of this public servant in her capacity on her last week in her job. She again had pointed out, and what happened, if it wasn't for these workmen working up behind where this morning, I was extremely alarmed and distressed. 25th of 10th 2018. By the if the workmen hadn't been using their cherry picker equipment, and the noise of that didn't wake me up at 9 o'clock in the morning, and the side effects these medications one's on, I wouldn't have heard the high heels of a female walking past my bedroom window in the ground floor flat today, and I wouldn't have known the colour of the car. So on a Thursday, so basically this social worker, she'd called me when I was in bed at 11:30 a.m, still groggy, and I don't get my personal care task until such time and the way it is, and that's why I've been going through months and weeks of offer of statutory law care act assessment 2014, and it's still in that process. Now, based on this factual information of first-hand knowledge, again, this social worker, public servant and female employee had to again inform another call handler, Maria, Capita PLC, Capita Business Services Limited, their call centre, using computers. That's what's causing all the bloody problems. Based on the information that this social worker had again informed of the factual information about myself to that individual who claimed the reason I could not get to the door to my private dwelling and location, and why I did not answer the door, and it's a block of flats by the way, at 9:15 a.m, was going to be put on the Capita's computer system. Will it be done again this right? I don't know. And basically it's already, how quick they work, I'll tell you this now. They quickly put it down on this assessor's computer system, which they have on the individual. They automatically send on computer, failure to attend team. So that means they stop my income as a vulnerable disabled individual straight away. Yeah, that's how they work. It's deliberately set up to trap disabled, vulnerable people that despite what you send off, despite what you do, they deliberately are setting you up to fail. And this even on a home visit, by the way. So I contacted my medical practitioner NHS funded surgery. I got a call back a short while ago. That on my medical notes wasn't even Capita. Hello? Anybody works for them? Are you doing your job right? Because you sure ain't for people like me. Well, anyway, that they didn't even contact my medical practice to confirm again why I cannot do a morning offer of a visit to a medical assessment, and why I need a chaperone, an individual that I know to help assist me with my medical disabilities, conditions. So despite all my efforts last week, and all the documents were sent in time on Tuesday the 23rd of this month, the 10th, 2018, to the Business Capita Department, the PO Box. Don't have a proper office. The head office is in London. The Capita PLC division, contracted by Department of Health and Pensions, a public purse again. Yes, it's a call centres. It's computerised. Everything is. So, obviously, they don't look at your documentation. It's obvious again they didn't. So, by finding on social and an email, I mean, this is the decision maker now by DWP is wrongly claimed again, despite the up-to-date factual information of evidence sent and delivered with special post, recorded post, to offer again 5 times in a row. This is, by the way. He again deliberately offered a morning appointment, knowing the fact I wouldn't be able to offer and even open the door, knowing the fact my disabilities, physical disabilities, affect me the way it does, knowing high care needs, I can't walk, and so basically they never contacted my GP. They never contacted the on the document since June, July 2018 this year. I updated them the fact that this particular social worker, she's leaving her job and I'm left without a social worker. I specifically sent off recorded post to the contact Capita call centre, and today this female called Maria, who works in the Capita PLC Darlington office in UK, put on the computer system what the social worker said, basically based on what my social worker has said. Again, informed the facts of why I could not get to the door unless I had wings and fly, and was put it on their computer system whether it does get done or not, and then she was informed already, appointment's already gone. So basically, using this statutory law known as Social Security Regulations 2013, the Department of Works and Pensions have put on, I failed, I did not attend. I put down, and I'm making notes here, they put down I failed to attend. So basically, what's trying to happen now is that this other care manager, different individual, I haven't even got I've just got an office phone number, I haven't got an email for her yet, and basically is trying to look into finding somebody to assist me to sit in if it's a big if, I get offered a proper PIP medical assessment on my own of an afternoon call. That was already agreed twice before that, many times before, and the last time was the 21st of Friday of September 2018. Then also agreed, all the calls recorded again by 3 times. One was 31st of the 8th 2018 on Friday by the same social worker, because I was there, so I was a care advocate at the time, and also on the 7th of the 9th 2018 I just come out of hospital then, and that was again the call to confirm that would be offered. And again, third time again, another call on the 20th of the 9th, Thursday, 2018. I would be offered an afternoon call. What do I get? I get a letter dated for today's date of a morning call. What the hell is going on? So it's obvious. And so I went on to research after I've finally trying to figure this out. There is a key areas of process of section 9 and 10 of the Social Security Regulation 2013, and how they're meant to input all of the circumstances. So how they're going to do the full picture of your nature, disabilities and mental health, physical health, whatever it might be, in the good cause. The good cause clause. The good clause. The good cause clause. The tongue twister that is. And unfortunately, well, doesn't matter if you're vulnerable in their system anymore in UK. It doesn't matter of your disabilities. The lack of equality at 2000 Statute Law 2010, the lack of disability reasonable adjustments statutory law, again, it doesn't matter if your complex physical needs and unable to walk and limited mobility, doesn't matter to them that you're wheelchair dependent, doesn't matter to them when you're seriously ill. It's a cleansing exercise of the most vulnerable in United Kingdom by the state blinking purse on behalf via these private limited corporations. So what the violations and abuses is the right of human rights of the most vulnerable in UK, and is absolutely deliberate. So the high amount of medical aids and equipment, I mean, if I know what I know and this happens to me and I'm extremely affected by this, so it's designed to this bigger picture behind all this. But when you're unfortunately trying to access goods and services, how can they ignore your factual evidence, your factual information? And it's not just me, by the way. This is caused by others as well on my behalf, with my consent. So they've cut me off by using their computer linking program. This is a problem with you. This is also going to affect onto this universal credit statutory system when you are unfortunately generally too unwell to work. It is not your fault. They imply it is, and that's what's going on. Because they're using this healthcare professional, they will not give the information out. There are I mean, I can't do it now. It has to wait till tomorrow. I need to rest now. But I've just made some notes that all the offers were done, the dates, everything, and they're putting the onus, the pressure onto individuals to prove, excuse me, we, i.e. the public, are the ones that have to prove for what? We haven't done nothing. We've done everything in due process. I mean, I've done everything under duress by force and cohesion. And so basically using their statutory system, because you're vulnerable, you're unwell to work, what they're trying to do, crucify us. So basically, on top of this, and I find that they don't even bother to look at your medical evidence, anything you send in. They might scan it into a computer. They do use a computer software. I knew that before. How your disabilities affect you, right? And then it's a combination. So, as I said to this NHS employee today on the phone, doctors that this is a serious risk, extra added costs onto the NHS funding. Is that absolutely, you know, the NHS England contracts separately in a contract also with Capita PLC for handling a lot of their data computer software and your medical notes too. So this is putting the health and safety of all. You're lucky if it doesn't happen to you, but how many cases you don't hear about? This is putting the well-being, the physical, the mental health, the health and safety of vulnerable disabled people in the United Kingdom at risk because of their incompetence, of their literally, I don't even know if anybody works, whoever sees this, for Capita PLC. Do you really give a monkeys of those that are, you don't know when you're going to get ill or get run over or have things happen to you in life. So there's automatic presumption that you might have friends or family on tap to help you. And there's cutbacks in access to advocacy support. So whether that may be via a postcode lottery, by the way, welfare benefits. There's very careful people charging for their services. There's a lot going on about this right now. And yeah, I just thank God I can't get to food banks. I'm in a wheelchair. You know. So I've just alerted this my own medical practice what's going on. Employees to put on the record. Could God forbid if it happens to me. It's in the hands of Capita PLC. Oh, conjunction with Department of Works and Pensions. They have all the records. They have your information. It's deliberately to make it give up. Even people that's working can claim this. It was the DLA. The old system was much better. They went on the evidence, and this will affect also if you're on, unfortunately, like the ESA, Employment Support Allowance, on the support group. All the medical evidence, everything is black and white. What are they trying to push on people? If I had my health, do you think I'll be still living in the United Kingdom? No. I'll be on a boat tomorrow. I'll disappear. I'll be blinking trying to find where else if I had my health tomorrow. I've always been that way. So no. Like this GP medical employee said, this is extreme added stress. And that's caused added onto, you know, it's the system's designed to fail. So it's worth checking out contract law, it's worth checking out common law and using what you know and find out best you can. Because 2 weeks waiting list or longer when you got nothing, absolutely disgusts me, this does. And you do everything in due lawful due process, factual evidence, factual record. And is this designed deliberately to make people psychologically distressed even further and to give up? What, to cut the in the national system? I'm not politically at all, but it's deliberately to fail, to put the onus on the individuals that have not caused anything. They're on a profit-making. They're profit-making corporations. Shame on you, CEO, board of directors at Capita PLC, who have American shares in private healthcare. Shame on you, all those that work in these companies, that you don't do your job effectively and you're affecting vulnerable disabled people, because this is not just about Capita. It's not just about person dependence. It's every state benefit that vulnerable disabled men and women, families with children as well, is affected. So if you don't contact a GP, make it factual evidence on record. So there is paper trail, right? So this guy says he's going to put it on get off, and type it all up on my medical notes. So there's a record. If anything happens to me, and I reduce my health, God forbid, there is evidence. And he shall be sued. I will have my next of kin inform them to take action. And thousands of people are absolutely going through just as much. Good job I have the DNA of my mum, I tell you that now. So, you have every lawful right to tape recorders. At least I'll try this out today. And I need some kind of, I do need the extra help on Department of Works and Pensions website, or go on to www.gov.org, UK is it, I think, and check out the date on the offer of additional support. Statutory policy dated 16th July 2018. That's what I've got to say right now. Extremely difficult to explain how washing, cooking, dressing, your everyday needs are. I began to learn what all this is about while I was going through this offer of Care Act 2014. It's similar questions to the questionnaires in the Pip. So there's more bigger things as well going on, not just on this subject, I know. But this is important that if you haven't got any spiritual beliefs, if you haven't got any kind of intellect or spiritual beliefs, then it's up to you. But I really strongly believe in your meditation. You're trying to keep yourself balanced as best as possible. While they want you to get extremely distressed, extremely orientated, not with it, and confused and alarmed. But these men and women work for the public as public servants in the job role, especially in this subject, and extremely causing a disadvantage. So please check out, if you want to know more, what is really going on in similar subjects. Disabled people against cuts. Just Google it and you'll find others throughout United Kingdom, perhaps Scotland and Wales too, what is going on. Crisis in housing, health, social care, now all this. There's a bigger picture to all this, but in the meantime, I'm trying to deal and get this out, what's happened today. And that's all I'm going to make for now. I'm going to switch off. But that email will be going tomorrow. But at the moment, no. There's a reason behind a lot of this, and this is unlawful. This is human violations, direct discrimination, and this is that's what I'm going to say for now. I've spent enough time of my energy on this, and I knew all this, a lot of things behind the scenes I had sense was going on, and it is unusual because there is presumption that you do have a friend or family members to assist one, and when that is not available. So yeah, absolutely, when your side effects all these medications and you're thinking extremely, oh my God, my reaction was genuine this morning. How can they ignore everything that you do and send? That's disgusting. Absolutely, more words. I can't even put it into words. So basically, the effects on trying to access any completion of a lawful goods and services and assessment one needs, since I can't even put it into words, because the conditions you also live in, your housing, the conditions you live to try, the trauma effects caused by certain things in your personal life, the efforts you make to try and get access to goods and services to meet your needs, and it's all privatisation even more. So I conditionally accepted of the services only under duress, because of my unfortunate situation, like thousands of people going through. So for those who have no clue what I'm talking about, you only need to live it 24 hours a day. And when you're needing, you know, the extra support, factual information and network, and there's always a reason why things are not happening the way they are. So to have the completion of factual evidence and first-hand knowledge, there is assumption, presumption being made, and just made a couple of notes of you don't have friends or family anymore. It's just unfortunate the way things are. There is medical evidence on record. Then now there's cutbacks. Even this Care Act advocate, the service on that is withdrawn because one is on a waiting list for a new allocation of an offer for social worker. So without a social worker, public servant in that angle, one cannot access other services. That's how it works in the United Kingdom. So it's all falling back onto the hands of the NHS England funded medical practices. And yet again, this is a letdown, a failure of the system. So it's not one. Do not ever blame oneself for the failings of others, because there's a serious negligence, deliberate negligence on these key private companies out to make profit or capita. So the public purse, if you're working, you haven't got any of this going on, your hard-earned taxes are paying these corporations, their chief executives, board of directors, profits to have luxury lives on the expense of the vulnerable, disabled, the elderly. And then if, God forbid, you ever come into the situation you need support and you haven't got your friends suddenly or family around you for whatever reason, and you fall in a similar position to I, then you already know what it's like. So there's no such thing as a perfect family, and you can't always get on with people. And I think it's more important nowadays to put your differences to a side if you're able to try and help each other out, because the system is collapsing. I only know damn well too well in other subjects I'm not going to ever speak about what's going on behind it all too, but I'm just sticking to this subject because I'm personally affected like thousands of others. I've got to go. You have a good night. I'm going to try and rest.